Now we can start the anatomy of the face. At first, we should talk about the boundaries of the anatomy of the face. From above, it is the hairline of the skull, from below the lower border of mandible, and on the sides the line that runs in front of the tragus of the ear. And in addition, we have some structures from superficial to a deep layer of the face. At first, we have a skin. When you cut the skin, you have superficial fascia, then deep fascia named parotid and mesenteric fascia in the face. These fascia had another name in the neck, and in the face we have just two parts of deep fascia named parotid and mesenteric fascia. And at the end we have facial muscles, mimetic muscles in the face. Okay, facial muscles have three groups. Number one, those muscles that are around the eyes. Number two, those muscles that are around the nose. And number three, around the mouth. When we divide different groups of the facial muscles, it is better to understand and it is easier. The muscles around the eye include two muscles: the corrugator supercilii, or we can say this muscle is a wrinkler of eyebrow. Okay, and another muscle is orbicularis oculi. The orbicularis oculi is a circular muscle of the eye, has a two or three parts. In this picture you can see both muscles. Corrugator supercilii is in the deep position of the orbicularis oculi. I mean that we should cut orbicularis oculi and then find corrugator supercilii in the deep position of this muscle. The corrugator supercilii attached to the bone, and it is a very small. The origin and insertion of these muscles is the corrugator supercilii originate from superciliary arch and then attach to the middle skin of eyebrow. And orbicularis oculi originates from the frontal process of maxilla, and also medial palpebral ligament. The fibers circle around and come back to the origin. We have a palpebral part that enters the upper and lower eyelids. It originates from the medial palpebral ligament, goes laterally and join to opposite eyelid, and the third part of orbicularis oculi is lacrimal part that attached to the lacrimal lake. It is a very small and it is hard to find. Attached to the lacrimal sac, excuse me. And the corrugator supercilii originate from the medial part of superciliary arc and attached to the middle skin of the eyebrow. The function of these muscles is produce vertical wrinkles between eyebrow and the forehead. Is the function of corrugator supercilii, and the function of orbicularis oculi is the movement of eyelids, and it is a slight help for drainage of the lacrimal sac. The muscles around the nose include three muscles. The procerus originates from nasal bones and inserts into the skin between the eyebrow. This muscle creates horizontal wrinkles at the root of the nose when you are thinking, concentrating, or when sunlight is strong. It can act in protecting the eyes and produce these wrinkles at the root of the nose. Number 2 is nasalis. Nasalis muscle originates on the nose. Its left and right parts joined together. It has a transverse part and an alar part. The transverse parts join together in the midline and originate from the body of maxilla. The alar part attached to the alar cartilage. Essentially, these muscles related to the nose supplied by the buccal or buccal branch of the facial nerve, seventh cranial nerve. Basically, all the mimetic muscles or facial muscles innervate by facial nerve. The action of nasalis. The transverse part compresses the nasal aperture and the alar part dilates the nasal aperture. And the third one is depressor septi nasi muscle. It is a depressor of nasal septum. This muscle originates from the maxilla near the central and lateral incisor teeth, goes to the nasal septum and pulls the septum downward. You can see in the picture three muscles, procerus, nasalis with two parts, and depressor septi nasi muscle. Okay, around the mouth there are more muscles. At first we have orbicularis oris. This muscle surrounds the oral orifice. and innervated by seventh cranial nerves. Its action include closing the lips, protruding them, helping to close the mouth, and pressing the lips against the teeth. Another muscle is risorius or laughing muscle. This muscle originates from the parotid fascia and inserts into the angle of the mouth. During laughing, it helps pull the angle of the mouth laterally. Another one is buccinator. It is deep in comparison with other muscle. It originates from the trigonomandibular raphe and alveolar process of the maxilla and mandible. Its action is to press the cheek against the teeth and help in chewing, produce the facial expression of blowing or whistling, and keeps food inside the mouth. Another muscle is levator anguli oris. It originates from the canine fossa on the body of the maxilla and attached to the modulus or angle of the mouth. In the both angles of the mouth, we have a structure named modulus. All muscles that want to attach to the angle of the mouth attach to this structure named modulus. Another muscles we can see depressor anguli oris, depressor labii inferior, and mentalis here. These muscles are around the mouth. Mentalis originate from the incisive fossa on the body of the mandible and insert to the skin of chin. Its action is produce some wrinkles on the chin. Depressor anguli oris originates from the mandible and attached to the modulus. Depressor labii inferior originates from oblique line of mandible and attached to the inferior lip. Here again we can see the facial muscles around the mouth. I show you with different colors and I explain these muscles from the upper to lower. At first, levator labii superioris. It originates from the body of maxilla and attached to the superior labia. Another muscle is levator labii superioris alae kniesi muscle. This muscle originates from the frontal process of maxilla and then attached to the alar part of nose and the upper labia. Another is orbicularis oris. We talked about it. Zygomaticus minor or minor and zygomaticus major. These muscles I show you with blue and green. originate from the zygomatic bone and descend to the mouse. The zygomaticus minor attached to the upper limb and the zygomaticus major attached to the angle of the mouse. Another is mentalis, we talked about it. Depressor anguli oris, buccinator and risorius, we talked about it earlier. Okay, after the facial muscles, we have a region called parotidomesenteric region. In this region, which is located in front of and below the ear, we have a muscle called masseter, a gland called parotid. In the thickness of the parotid gland, we have very important structures, for example, facial nerve, external carotid artery, and retromandibular vein. These structures are in the thickness of the parotid gland. In the parotidomesenteric region, I said that we have a muscle, masseter muscle. The masseter muscle is a muscle that you can see on the ramus of the mandible. It also covers the angle of the mandible, as you can see in the picture. It originates from the lower border and inner surface of zygomatic arc. Its fibers run downward and backward and insert on the outer surface of ramus and the angle of the mandible, as well as coronoid process. There is a masseteric fascia here that lies on the outer surface of masseter and is a continuation of the parotid fascia. Masseteric fascia and parotid fascia are deep fascia of the face. The masseteric nerve is a branch of mandibular division of the trigeminal nerve, cranial nerve 5. On the outer surface of the masseter, you can see a green structure. It is parotid duct or Stenson duct. Parotid duct emerges from the anterior border of a parotid gland, crosses the outer surface of masseter, and finally empties into the oral vestibule opposite the upper second molar teeth. The parotid gland is located in the parotidomesenteric region. It is an irregularly shaped gland that has a base above and an apex below. It has an outer surface and inner surface and has a duct. I said about it and explain it. The duct of parotid gland emerges from the anterior border of the gland and crosses the outer surface of masseter. In fact, the capsule of parotid is thick, and there is three structures in the thickness of the parotid gland: the facial nerve or seventh cranial nerve, retromandibular vein, and external carotid artery. The seventh cranial nerve or facial nerve is motor. This nerve enters the internal acoustic meatus, travels in the facial canal of the petrous bone, and exits from a stylomastoid foramen of the petrous of the temporal bone. Then enters the substance of the parotid gland. Inside the parotid gland, it gives some branches. You can see in the picture. The first branch is temporal branch. The second is zygomatic branch. Another is buccal branches. We have some branches of buccal in the face: superior buccal bundle and inferior buccal bundle. And on the cadaver, we can see that this is it has different branches here named buccal. Another is marginal mandibular branch, you can see in the picture, and finally cervical branch. These branches arises from the facial nerve. I show you with red line. The buccal branches are around the parotid duct. You can see in green in the picture. And this is a guideline for the finding of buccal branches. These branches innervate the mimetic muscles of the face or facial muscles. Here we can see another section of the parotidomasseteric region in the face. In the upper picture, we can see a transverse section of the face, and in the lower picture, we can see the lateral surface of the parotid gland. In the upper picture, we can see the pathway of the facial nerve in the thickness of the parotid gland. This nerve emerges from anterior border of parotid and gives 5 branches. These 5 branches are clear in the lower picture: temporal branch, zygomatic branch, buccal branch, marginal, mandibular, and cervical branches. Before entering the facial nerve into the parotid gland, we have some branches for muscles. As you can see in the picture, I show you with yellow stars. Posterior auricular nerve for auricular muscles, and the nerve to posterior belly of digastric muscle and to stylohyoid muscle. So we can conclude that Some suprahyoid muscles innervated by the facial muscle. These muscles are posterior belly of digastric muscle and stylohyoid muscle. And in addition, mimetic muscle or facial muscles innervated by the facial nerve. Here we can see a comprehensive picture about facial nerve. From brain to the face, this nerve has sensory fiber and almost motor fibers. In addition, parasympathetic fibers. You can trace each branches to the target organ. In this picture, you can see a very common problem that comes for the seventh nerve or facial nerve. It is some kind of paralysis of this nerve, which we call Bell's palsy. The affected half of the face shows drooping, eyelid comes downward, the angle of the mouth is pulled to the opposite side, why we see this appearance after facial nerve paralysis? Because the innervation of mimetic muscle or facial muscle that shape different parts of face is facial nerve. So when the facial nerve paralyzed, the face of the face of the patient will be unusual, and different parts of the face come into problems, and as you can see in the picture, we have some problems, and it is important in clinic. The next structure we have in the thickness of the parotid gland is retromandibular vein. This vein comes from the confluence of the superficial temporal and maxillary vein, descends inside the substances of the parotid gland, and divides into two branches, anterior branch and posterior branch. Anterior branch joins the facial vein, and posterior branch joins the posterior auricular vein and form the external jugular vein, as you can see in the picture. Another structure in the thickness of parotid is external carotid artery. This artery opposite the neck of the mandible gives two terminal branches, the maxillary and superficial temporal. The maxillary branch enters the infratemporal fossa, and the superficial temporal branch emerges from the upper border of gland or parotid gland, and have some branches for the face and scalp supplement or blood supplement. You can see external carotid artery again with schematic image. The red one is external carotid artery. When it goes upward, divides into two branches, superficial temporal and maxillary artery. Here we can see the branches of the superficial temporal artery with different colors. This artery is one of the two terminal branches of the external carotid. First, it gives the transverse facial artery. This artery runs laterally from the external carotid path between the parotid duct and zygomatic arch and supplies the face. The next branch is anterior auricular artery. It is for blood supplement of the external air and some small parts of face. The middle temporal branch is another branch of superficial temporal. It pierces the temporal fascia above the zygomatic arc and supplies the temporalis muscle. At the end, when the superficial temporal artery emerge from the upper border of the parotid gland, gives two branches, frontal branch and parietal branch. Frontal branch goes toward the frontal region and forehead, and parietal is in the posterior position. These two branches are for blood supply of the scalp. So we can review the branches of the superficial temporal artery. At first, transverse facial, zygomatico-orbital. This branch is in green, I show you, and goes toward the angle of the eye. Middle temporal branch, anterior auricular for the auricle and external air, and finally frontal and parietal branches.